Today, I want to share some of the latest trends in prostate cancer, which is a common condition that affects many men. Over the past few years, we've made progress in early detection, new treatment options, and using more personalized approaches to care. But what's really interesting lately is the connection between prostate cancer and gut health. You might have heard of the gut microbiome. It's the collection of bacteria and other microorganisms that live in our intestines and help keep us healthy. Recent research is suggesting that these microorganisms may have a bigger role in prostate cancer than we thought. They could be influencing how the cancer develops, how the body fights it, and even how well certain treatments work. In this talk, I'm going to break down these new trends and take a closer look at what recent studies are saying about the link between prostate cancer and our gut health. Prostate cancer is one of the major cancers that affects men around the world, especially as they get older. It's actually the second most commonly diagnosed cancer in men, and unfortunately, it's also one of the leading causes of cancer-related deaths. In 2020, there were over 1.5 million new cases of prostate cancer reported, and around 375,000 men died from it. In the US, prostate cancer makes up about 26% of all cancers in men, and it's the second leading cause of cancer deaths among men. Now, when we talk about risk factors for prostate cancer, age is a big one, along with things like genetics, a high BMI, high blood pressure, and low physical activity. If a man has higher testosterone levels for a long period of time, his risk of getting prostate cancer can go up. Also, mutations in the BRCA1 and BRCA2 genes can significantly increase the chances of developing prostate cancer. Men with these mutations are considered high risk. This is why if someone has a family history of prostate cancer, early detection and preventive care are super important. In the early stages, prostate cancer might not have any clear symptoms, which is why it can be tricky. But as the cancer progresses, symptoms like difficulty urinating, frequent urination, blood in the urine, and even issues with sexual function can start to show up. If the cancer isn't caught early, it can spread to the lymph nodes and bones, which makes the prognosis a lot worse. So, according to the AUA guidelines, they recommend considering PSA screening for men between the ages of 55 and 69. This age group is seen as a key period where PSA testing can help reduce death rates from prostate cancer. But it's really important to have a thorough discussion with the patient about the pros and cons of the PSA test before making any decisions. You need to think about things like life expectancy, personal preferences, family history of prostate cancer, and other risk factors. For men over 70, routine PSA screening isn't really recommended. In fact, if their life expectancy is less than 10 years, the guidelines suggest it's best to avoid prostate cancer screening altogether. When interpreting PSA test results, it's not just about the absolute PSA number, but also looking at the trend, like how fast the PSA is rising over time. This is called PSA velocity, or how long it takes for the PSA to double PSA doubling time. According to the AUA, here's how we can break it down. If the PSA is below 4 nanograms per milliliter, generally the chance of prostate cancer is considered low, but you can't completely rule out the possibility of a significant cancer even with low PSA levels. PSA between 4 and 10 nanograms per milliliter. The likelihood of prostate cancer is around 25%. In this range, other conditions like benign prostatic hyperplasia or prostate inflammation could also be the cause, so further tests might be needed. PSA over 10 nang per milliliter. Here, the risk of prostate cancer jumps to over 50%, and it's highly likely that more tests, like a biopsy, will be needed to confirm the diagnosis. One important factor we look at is PSA velocity, which, if it's rising by more than 0.75 nanograms per milliliter per year, could suggest a higher risk of cancer. There's also something called PSA density, PSED, which is a measure of PSA relative to the size of the prostate. If the PSAD is above 0.15 nanograms per milliliter per cubic centimeter, it could indicate a higher chance of prostate cancer. These extra markers are especially helpful for patients with borderline PSA levels. Beyond just PSA levels, the AUA guidelines also recommend using a combination of MRI and prostate biopsy for diagnosis. MRI is becoming more popular because it helps us get a clearer picture of any abnormal areas in the prostate and reduces unnecessary biopsies. Okay? Unlike traditional ultrasound-guided biopsies, MRI can more accurately detect high-risk lesions and help avoid overtreatment of low-risk ones. In addition, the guidelines suggest considering newer techniques like genetic testing, especially for high-risk patients. For instance, tests to see if someone has mutations in the BRCA1 or BRCA2 genes can help identify high-risk individuals and guide us towards recommending more aggressive treatment when needed. So the results of a PSA test are more than just the number. It's really important to keep monitoring PSA levels regularly in managing and diagnosing prostate cancer. If PSA levels continue to rise or show unusual changes, additional tests like a biopsy or imaging might be needed. However, for patients considered low risk, the guidelines recommend what's called active surveillance, where we avoid unnecessary treatment. The focus is on watching closely, but not over-treating, which can be really important. According to the AUA guidelines, PSA testing alone isn't a perfect diagnostic tool. It's just the starting point for prostate cancer diagnosis, and we need a more comprehensive approach tailored to each patient's situation. Further tests should always follow to make a final diagnosis. One of the most exciting new techniques in prostate cancer diagnosis is the use of multiparametric MRI. According to the AUA guidelines, MRI is super helpful because it shows us detailed images of the prostate, including where any lesions might be. This makes it much easier to get an accurate diagnosis. The MRI uses something called a PIRADS score to help assess the risk of cancer, which is a great tool before doing a biopsy. One big advantage of MRI is that it not only helps identify where the lesions are inside the prostate, but also shows how deeply the cancer might have spread and whether it has moved to nearby tissues. This helps reduce unnecessary biopsies and allows us to target high-risk lesions more precisely. The AUA recommends combining MRI with ultrasound for a more accurate biopsy. This technique, called ultrasound fusion biopsy, merges the images from the MRI with live ultrasound during the biopsy, allowing us to target suspicious areas more accurately. It has a higher success rate compared to traditional random biopsies, especially for finding high-grade cancer. This type of biopsy also lowers the chance of a false negative, which is a big improvement in diagnosing prostate cancer. The AUA guidelines suggest using MRI and fusion biopsy even in patients with suspected cancer recurrence or when PSA levels are rising abnormally. This combination is really helpful for both diagnosis and planning the treatment. Another innovative technique is liquid biopsy, where we analyze things like tumor DNA or tumor cells in fluids like blood or urine. This is one of the newest tools to help detect and monitor prostate cancer. According to the AUA guidelines, liquid biopsy can be especially useful in patients with metastatic prostate cancer, or in cases where traditional tissue biopsy might not give us enough information. The great thing about checking for biomarkers in blood or urine is that it's non-invasive, so it can be done repeatedly. This lets us track how well the treatment is working in real time. It's especially helpful for metastatic prostate cancer patients, allowing us to monitor genetic changes in cancer cells during treatment, which brings precision medicine into the picture. While liquid biopsy doesn't fully replace traditional tissue biopsy yet, the AUA recognizes its potential as a valuable tool, especially for patients with recurrent or high-risk prostate cancer. One of the key molecular characteristics of prostate cancer is mutations in the BRCA1 and BRCA2 genes. According to the AUA guidelines, having a BRCA mutation significantly increases the risk of developing prostate cancer. Patients with BRCA1/2 mutations are more likely to develop metastatic prostate cancer, and unfortunately, their cancers tend to be more aggressive and have a worse prognosis. Prostate cancer patients with BRCA mutations generally need more aggressive treatment. These patients often don't respond well to standard therapies, so they require more personalized, targeted treatments. The AUA recommends genetic testing to identify these mutations early so that the right treatment can be planned. For patients with a family history of BRCA mutations, genetic counseling and regular screenings are recommended. This can help identify high-risk patients early and provide an opportunity to prevent metastatic cancer. The androgen receptor pathway is a key driver of prostate cancer cell growth. When androgens, male hormones, bind to the AR, they stimulate the cancer cells to grow. According to the AUA guidelines, blocking the AR is a major part of prostate cancer treatment, especially in cases of metastatic castration-resistant prostate cancer. Newer AR inhibitors play a huge role here. Drugs like enzalutamide, apalutamide, and darolutamide, which are newer AR inhibitors, are much more effective than older anti-androgen treatments. These drugs have really improved outcomes for patients with metastatic prostate cancer. The AUA suggests that these medications be used aggressively in high-risk or recurrent patients to improve survival rates. PARP inhibitors have become an important treatment, especially for patients with BRCA mutations. According to the AUA guidelines, PARP is an enzyme that helps repair DNA damage, and PARP inhibitors block this repair process, which prevents cancer cells from fixing their damaged DNA, eventually leading to their death. Drugs like niraparib and talazoparib, which are PARP inhibitors, have shown great results in patients with metastatic prostate cancer who have BRCA mutations. Clinical trials have demonstrated that these drugs can extend survival. The AUA recommends using genetic testing to identify BRCA mutations and then treating these patients with PARP inhibitors as part of a targeted therapy approach. PARP inhibitors offer a new option, especially for patients with recurrent prostate cancer who aren't responding to other treatments. As more data is collected from ongoing clinical studies, we expect even more insights into the effectiveness of these treatments. In recent years, immunotherapy has made some important advances in treating metastatic prostate cancer. According to the AUA guidelines, prostate cancer has traditionally been one of those cancers that didn't respond well to immunotherapy, but now new immune therapies like immune checkpoint inhibitors are showing positive results for certain patients. Checkpoint inhibitors such as PD-1 and PD-L1 inhibitors work by blocking the mechanism that cancer cells use to hide from the immune system. This allows the immune cells to attack the cancer more effectively. Although these inhibitors have shown some response and limited group of prostate cancer patients. The overall clinical effect has been somewhat underwhelming. That being said, patients with specific molecular characteristics like MSI-H or DNA repair gene mutations might benefit more from these drugs. So in those cases, they can be part of a precision medicine approach. The AUA guidelines also highlight the approval of cell-based immunotherapy like Sipuleucel-T, Provenge, for metastatic prostate cancer patients. Sipuleucel-T works by activating the patient's natural killer NK cells outside the body and then reintroducing them to help attack cancer cells. This treatment has fewer side effects than traditional chemotherapy and can improve survival while maintaining the patient's quality of life. It's especially recommended for patients with metastatic castration-resistant prostate cancer, mCRPC, where it has been shown to extend survival, making it one of the early treatment options for metastatic prostate cancer. PSMA, prostate-specific membrane antigen, is a protein that is overexpressed on prostate cancer cells. Recently, there's been a lot of attention around a new treatment called lutetium-177, PSMA-617, radioligand therapy, which targets PSMA. The AUA guidelines view this PSMA-targeted therapy as a promising option for metastatic prostate cancer patients who haven't responded to other treatments. The way PSMA-617 works is by attaching a radioactive isotope to PSMA, allowing it to specifically target and destroy prostate cancer cells. The great thing about this treatment is that it minimizes damage to normal tissues while still effectively destroying cancer cells, even those that have spread. Studies have shown that it's been successful in controlling advanced prostate cancer in patients who failed previous treatments, and clinical trials have demonstrated improvements in both survival and slowing down the progression of the cancer. Right now, lutetium-177 treatment is used for patients who show PSMA expression on a PSMA PET scan. The AUA considers this therapy as an important new option that could potentially become the standard treatment for metastatic prostate cancer. It's changing the way we treat prostate cancer and could play a major role in treating high-risk patients or those who don't respond to other therapies. Recent studies suggest that gut microbiota might be closely linked to the development and progression of prostate cancer. According to the AUA guidelines, while a clinical application of gut microbiota research is still in its early stages, it's believed that gut bacteria may play an important role in immune response and hormone metabolism related to cancer. Certain bacteria, like ruminococcus, may affect the metabolism of male hormones like testosterone, which could promote the growth of prostate cells. This has been proposed as one of the key mechanisms in the development of prostate cancer. Testosterone, as we know, stimulates the growth of prostate cells, and an imbalance in gut bacteria may enhance this process. For example, people who consume high-fat diets may experience changes in their gut bacteria that affect hormone metabolism, potentially increasing their risk for prostate cancer. There are also reports suggesting that an imbalance in gut microbiota, known as dysbiosis, can trigger inflammation, leading to a widespread inflammatory response. This leaky gut phenomenon increases intestinal permeability, allowing inflammatory substances to enter the bloodstream and potentially contribute to the development of prostate cancer. Studies have shown that patients with chronic inflammation have a higher incidence of prostate cancer compared to those without inflammation. Interestingly, some gut bacteria might actually help prevent prostate cancer. For example, Faecalibacterium prausnitzii produces short-chain fatty acids, SCFAs, that have anti-inflammatory properties, which could help slow down cancer cell growth One study comparing the gut microbiota of prostate cancer patients and healthy individuals found that those with prostate cancer had less microbial diversity and more inflammatory bacteria. In contrast, healthy people had more of these anti-inflammatory bacteria like Faecalibacterium. There's also growing interest in how gut bacteria might affect a patient's response to prostate cancer treatments. Some studies suggest that patients undergoing radiation therapy who have lower gut microbial diversity may experience worse side effects. On the flip side, patients who maintain a healthy gut microbiome might have fewer side effects and better treatment outcomes. This is still being explored, but it could be an important area for future research. Although research into gut microbiota and prostate cancer is still in its early stages, there's potential for it to play a role in the treatment and prevention of prostate cancer in the future. This is an exciting area of study and will likely see more clinical applications as research continues to develop. So that wraps up today's presentation. Thank you for taking the time to listen. Even though it may not have been perfect, I really appreciate it. I hope that I'll have another chance to present to you again sometime in the future. Thanks again.